Hi, everyone. It's Dr. Pete Peduzzi with another great Wednesday morning podcast here at the American Back Centers, the Disc Relief Centers of Pittsburgh. Welcome, welcome, welcome. And I have my little friend Gizmo here. Gizmo, come on over. Come on over. He's our dog. He's 7 years old. Every once in a while makes a little guest appearance to our show. Say hi, Gizmo. He's going to be helping me today with this show. He's a cutie pie. All right, Gizzy, go back to sleep. So I got an interesting question that I want to start off the show that I want to address, and it goes on to state, and if you are new to the American Back Centers and Disc Relief Centers of Pittsburgh, we're located here in Wexford, PA, right here in the very busy Cranberry-Wexford corridor here, right down the street from the new AGH Hospital, Allegheny Health Network Hospital, I should say, right in between the car dealerships, the Tesla, the Bentley, and Walnut Grill, right at the bottom of that hill there, right off of Route 19 on exactly 103 Bradford Road, Building 2, Suite 100. We've been here for over 15 years now. I purchased the practice from Dr. Miskovich. He just passed away this past year. Very sad to say that, of course. And this practice, American Back Center, has been around for close to 50 years. And we've been specializing in the treatment of very difficult disc-related cases. And we are Pittsburgh Disc Specialty Center for over 25 years now, one of the most experienced disc centers in the country. Of course, it's Wednesday. We're closed. I'm off here doing the podcast. And starting off with this question, with so many advancements in non-surgical pain management, what are the most important factors for patients to consider when choosing between traditional surgical approaches and innovative non-invasive therapies like we offer here at the American Back Centers? And we have really the best non-invasive therapies out there. When you look at the research, when you compare these glorified traction devices that claim to be decompression, and the term decompression is so loosely used, I talk about this all the time. Anything can call something decompression. There's a pump up device. No offense to the posture pump. We have it here in the office. It's a great device for restoring curvature to your spine, but that's pretty much what it does. It's not actually creating negative pressure. And that negative pressure is essential to counteract the positive compressive forces that occur when the spine compresses. And this doesn't happen in one day, doesn't happen in 1 week. It happens over a period of months, if not years, where that spine compresses. And I'll show you my model here again. This model of the spine, you can see how slowly the spine compresses. You may have seen this many, many times. Nice fat disc, healthy, water-filled disc, healthy space. Over time, due to sitting at a desk, sitting in a car, sitting in a truck, bending, heavy lifting, car accidents, slip falls, whatever it may be, the spine will start to compress. When the spine compresses, what happens? The disc starts to lose fluid. It starts to dry up. You'll hear the term degenerative disc disease. Arthritis is occurring now. The bones start to form little jagged edges that eventually want to fuse, very much like a knee joint or a hip joint. And eventually you'll have total fusion. And then the facet joints on the backside will fuse. You hear the term posterior facet syndrome. The disc will start to bulge, herniate, push on your nerve, creating sciatica, pain down your arm if it's in the neck, numbness in your finger, hand, weakness, same thing in the leg, weakness in the leg, foot drop, etc. Even loss of bowel and bladder control later on in more serious, more severe cases. So again, that doesn't happen in 1 week, doesn't happen in 1 day. It happens over a period of months, if not years. I'm just going back to that question that was given to me. Again, important factors for patients choosing between traditional surgical approaches and innovative non-invasive therapies like we have here. And there's a lot of questions out there, can I go down the street? My doctor has decompression. Well, he doesn't have decompression. If you look closely, to decompress, you have to do it surgically, which we all know has many, many drawbacks. They have to go in there, rip out ligament, bone, and tissue to get to the area, cutting off a very important piece of disc that might be bulging. Yes, it's bulging, but it's an important piece of your disc. Now you have less cushioning, less disc to work with. Now, if the spine's already compressing, you're losing water, you're losing fluid, so the disc is already dying, it's already desiccating. There's no blood supply after the age of 25, right? So I'm sure most of you listening out there are over the age of 25, so your discs have no blood supply, no way for them to heal themselves on their own. Now, some people think, well, if I take a pain pill, if I get an epidural injection, it will buy me some time and my body will heal itself. And some people state out there that 70 to 80% of all disc problems heal on their own. That's simply not true. How could they? If you continue to do what you're doing, prolonged sitting, prolonged living, bending, weightlifting, car accidents, whatever, all these microtraumas that add up over time, it's only a matter of time till you start to have degeneration of your disc. With that, you start having problems. So when they cut in there and cut that very important disc or bone out, now you have less support structure. So you're actually more susceptible to injuries. Then when they go in there and eventually put rods and screws in your back, it's even worse now. More invasive, you have the risk of permanent complications with those rods in there. That segment cannot move anymore. So the segments above and below that already, in most cases, are suffering, now get worse because they have to compensate even more for the fixed segment that's fused, not including the risk of infection, blood clots, scar tissue, all types of other complications that can occur every time they cut into you. So the non-invasive approaches should always be the first approach. Exhaust all your conservative treatment options first. We all know that. Before you blindly undergo the knife, because the knife, even with the laser back in the day, the Laser Spinal Institute, laser spinal surgery, they're not even existing anymore. People don't do it because it's not effective. And these people were inducing patients to come out to them, paying for their plane tickets. They were caught up with Medicare. They were caught up with other legalities and pretty much put out of business. There were a lot of horror stories where people got much, much worse and attributed to their deaths to this Laser Spinal Institute as well, the surgery and such. So they were pretty much put out of business. And we saw that a long time ago, that there was no benefit to using a laser over a scalpel. They're still ripping out ligament, bone, and tissue, going in there, causing potential permanent complications. So the question should always be, why would you even think about risking these permanent complications when you have something as safe and effective as VAX-D that we offer here? Vertebral axial decompression, true decompression. And again, we quote the Ramos and Martin article, two neurosurgeons, Dr. Ramos and Martin, published in the Journal of Neurosurgery, showing for the first time and still to date the only research of its type proving that a non-invasive, non-surgical decompression table, and again, a lot of people claim to decompress, actually does what it says it does. Create negative pressure, upwards of a negative 160 millimeters of mercury. They use pressure sensors in real live patients, showing that every time that negative pressures are achieved, and this research was only done on VAX-D. And that's important to note because many people claim that they produce negative pressure. They do the same thing as VAX-D. Well, guess what? There's no proof. And I'm still asking anyone if they have any research proving that they actually produce negative pressure. And nobody can reproduce that at this time. The only research was done on VAX-D. And we offer VAX-D right here at the American Back Centers, the Disc Relief Centers of Pittsburgh. We are Pittsburgh exclusive provider for this type of therapy. It has an over 92% success rate. Non-invasive, non-surgical, without any cutting, without any drugs. We do therapy and rehab here, very important component of the disc protocol. It's not going to pull a disc back into place alone. It's not going to heal your disc alone. Our initial protocol is getting the disc stabilized. We have certain protocols, wearing a back brace, taking certain supplements, restricting your activities, getting the treatment first in a conservative fashion. Then we incorporate the rehab into the program, which helps to supplement what we do with the VAX-D, getting the disc under control, pulling it back into place, pulling the water, oxygen, nutrients back into that compressed, starved disc, pulling the disc out of your canal, relieving your spinal stenosis, pulling the disc off your nerve, relieving your sciatica, your pain, your suffering first, getting things under control, and then slowly incorporating rehab and activity back into the patient, which is very important. Bed rest was something they did many, many years ago, which just made the patient worse. So when we compare these other therapies, epidural injections, pain medication, Band-Aids at best. In some cases, you may get an epidural. It takes your pain away, at best a couple months, couple weeks, and somehow they don't have problems again. It can happen. It can definitely happen. I've seen it. But in most cases, it just buys you some time. And it's only a matter of time now. You're just covering up what's happening. The spine still is compressing, and you get to a point where it's almost bone on bone now. And it makes it more difficult for us to help you. Now, we can still help people with bone-on-bone conditions, opening up that spine a bit. But very much like the knee joint, when you're bone-on-bone, there's not much you can do at that point. So you don't want to get to that point. So if you see you have some bulges, herniation, you have pain, leg pain, arm pain, come in and see us and see if we can help you. You have nothing to lose but your pain by coming in and talking with us and see if we can help you. And again, non-invasive approach is really the best approach when you look at surgery. Not all surgeries fail, but why risk surgery and all the potential permanent complications when you have something as safe and effective as VAX-D? We offer it right here at the American Back Centers, the Disc Relief Centers of Pittsburgh. Call our office, 724-935-3300. Again, visit www.americanbackcenters.com. You can schedule an appointment right on the website and learn more about what we do. Again, www.americanbackcenters.com. All right, we're going to move to our segment today. How sleep deprivation impairs cognitive performance and learning. Definitely a nice article I wanted to pass along to you guys today. And let's see here. So as we go on down here, we always give you a little summary first. This is from Mercola.com. Great resource for my podcast. Great resource in general for you. And you can visit his website, Mercola.com. MERCOLA.com. So it goes on to state, sleep deprivation significantly impacts learning by affecting your hippocampus, which plays a role in long-term memory formation. Both REM, rapid eye movement, and non-REM sleep stages are necessary for effective learning and memory consolidation. Even minor sleep restrictions negatively impact memory, producing effects on memory formation and retention comparably to those caused by complete sleep deprivation. Creatine supplementation helps partially offset cognitive declines caused by lack of sleep. Believe it or not, a lot of people have knocked creatine for many, many years for potential kidney problems. Now, if you do have kidney issues, I don't think you should be taking a lot of creatine because it could impair it. But for the most part, if you're a normal, healthy person, it can help with the cognitive decline caused by lack of sleep by replenishing the brain energy stores, reducing fatigue, and improving memory and processing capability. Strategies, to improve sleep quality are included in this article, such as maintaining consistent sleep schedule, creating a restful environment, and reducing exposure to light in the evening. So as we skip on down, could missing out on sleep be undermining your academic and work achievements? Recent studies suggest it's true. Only 26% of Americans meet the recommended 8 hours of sleep each night, and this widespread sleep problem has profound implications for cognitive and physical performance. When you skip a night's rest, you're not only battling exhaustion, research shows that sleep deprivation significantly impairs your reaction time, elevates your blood pressure, compromises your memory formation, reduces attention span, and hinders executive functioning, all of which are vital for successful learning and everyday decision making. If you're facing this challenge, you're not alone. Understanding specific ways sleep deprivation affects your brain and adopting strategies to regain your cognitive functioning helps address the root causes of sleep loss, enhancing both performance and overall well-being. So the next question is diagnosing and addressing this problem. Diagnosing sleep deprivation often begins with self-reported sleep patterns. Individuals are typically asked to track their sleep duration and quality over a period of time. This can help with the understanding of their sleep habits and help identifying any discrepancies from recommended sleep duration. So as we skip on down to gain a more objective measure, various tests are employed to assess the impact of sleep deprivation on cognitive, physical performance. Reactive time tests are commonly used to evaluate how quickly an individual responds to stimulus. So reaction time tests. Also, some other tests are important because sleep deprivation are known to slow reaction times, which can particularly be dangerous in situations such as driving a truck or operating machinery. Memory tests are another tool to help gauge the effects of sleep deprivation. These tests often involve recalling information or recognizing patterns, which are significantly impaired when an individual is sleep deprived. Other things involve conventional methods for addressing deep sleep deprivation, typically focuses on improving sleep quality and duration. This involves lifestyle changing, such as establishing a regular sleep schedule, creating a restful sleep environment, so a dark room, quiet room with not a lot of electrical EMF devices, keeping you awake and stimulating your body, reducing screen time before bed. Supplements like melatonin are often sometimes recommended to help regulate sleep cycles. We're going to cover some more tips later in this article, as he mentions here. Impact of sleep deprivation on brain functioning and learning abilities. We all know this. It significantly impairs learning by affecting your hippocampus, the part of the brain that plays a central role in long-term memory function. We skip on down here. Moreover, researchers highlighted the importance of both REM and non-REM stages in memory consolidation. Disruptions in either stage negatively impairs how well memories are formed and stored. These disturbances in sleep patterns lead to noticeable declines in memory performance. So again, indicating that recovery is possible with proper rest. Noted if you have short-term sleep loss, does not cause permanent damage to learning abilities. This can be recovered with proper rest. A well-rested brain is better equipped for tackling your daily challenges and processing new information effectively. We all know this. Making sure the necessity of sleep routines for optimal cognitive functioning. Even minor sleep loss weakens memory retention. This is from the Journal of Neuroscience and Behavioral Reviews, confirmed that restricting sleep even just a few hours fewer than usual negatively affects how well you form and retain memories. If you're not getting enough sleep, your brain's ability to process and store new information takes a hit. This happens because sleep plays an important role in strengthening the connections between your brain cells, which is essentially for memory formation. Without adequate sleep, these connections don't strengthen as effectively, making it harder to remember what you've learned. So we skip on down here. The studies show that the effects of sleep restriction on memory are similar to those caused by complete sleep deprivation. That means that even partial sleep loss can lead to noticeable declines in memory performance. So it's important, if you're not getting enough sleep, make sure you get some sleep. The days following, the long-term effects is where the problems occur. As we skip on down here, talking more about this. It talks a little bit more about how it affects the brain and the different cortexes. Why don't we skip on down to creatine? Helps counteract the effects of sleep deprivation. It's not something you need to do and not sleep, but if you're not getting enough sleep for whatever reason, you're doing your best, and you have a day here or there, creatine, though, will help with that. So, I mean, the moral of the story is make sure you're getting sleep and you're not restricting your sleep intentionally, but this will help for those days that you miss. So creatine is well known for enhancing physical performance, but also plays a key role in brain energy metabolism. When sleep is limited, the brain's ATP stores, which fuel cognitive functioning, become depleted more quickly. So a 2024 paper published in the Scientific Reports stated found that creatine supplementation boosts your brain's ability even when you're not getting enough sleep. It showed a study there showing the effectiveness of creatine, and showing again that creatine supplementation may be something you may want to consider to help with that, especially if you're not getting appropriate sleep due to your job or other, maybe having a baby, some things out of your control. So these strategies will help you sleep better. Number one, establishing a consistent sleep schedule. Going to bed and waking up at the same time every day helps regulate your body's internal clock. Aim for 7 to 8 hours of sleep each night and try to stick to your schedule even on weekends if you can. It's just going to help you. Do you try to sleep in too far on the weekends, you're going to have trouble Monday morning. And that's why people have trouble on Monday morning, because they sleep in too much on the weekends. Consistency reinforces your circadian rhythm, making it easier to fall asleep and wake up naturally. Number two, creating a restful sleep environment. The bedroom should be a sanctuary for sleeping. Ensure your sleeping area is quiet and cool. We talked about having the temperature between 60 and 68. If you have it too hot, you're not going to sleep good. Put a blanket on. Put a shirt on. Dark is important as well for melatonin production. Cool and quiet. Promoting uninterrupted rest. Can't talk today, sorry. Uninterrupted. The optimal temperature for sleeping is between 60 and 68 degrees Fahrenheit. Remove any TVs, electronic devices, reducing noise. Using a white noise machine sometimes can be helpful as well. Investing in a comfortable and supportive mattress and pillows help you get a good night's sleep as well. Consider replacing your mattress if it's over 9 to 10 years of age and you want a firmer mattress. Number three, limiting exposure to light before bedtime. Phones, tablets, computers, bright lights. Dimming the lights in the evening will help signal your body that it's time to wind down, enhancing your sleep quality. Number four, managing stress through relaxation techniques, meditation, yoga, breathing exercises, calming the mind before your bed, doing something calming, not stimulating before bed. Number five, eliminating EMF fields in your bedroom. Again, disrupting your pineal gland, production of melatonin, serotonin, unplugging these electronic devices. Even turning off your Wi-Fi before bed can be beneficial. Exercising daily, not right before bed, but exercising daily will help your body sleep more soundly. And trying emotional freedom technique, it's one of the techniques he has, similar to meditation for relaxation and de-stressing. And these are some great tips here. He talks about, again, some other things about healing and longevity in his article here as we go on down. Cell health as well. Some things he's just talking about with some of the books that he has mentioned in his articles. So a nice little article. I wanted to pass along to you again how not getting enough sleep can actually impair your cognitive performance and learning capability as well. Very, very important to note. Many people are unaware of this. They forget about this. And it's very, very important to note this topic. And so I just want to leave you with some final closing thoughts here. I'm very happy that you were here for the podcast. We're going to be on every Wednesday with another brand new podcast here from the American Back Centers and the Disc Relief Centers of Pittsburgh. Again, avoid surgery at all costs if you can. Always exhaust all your conservative treatment options first before you blindly undergo the knife. Not all surgeries fail. I mean, we see Bishop Zubik of the Catholic Church here in Pittsburgh. He's on like his 7th back surgery. You don't want that. And I always tell people, sometimes, insurance covers surgery. You're still going to have out-of-pocket expense with that surgery. They don't tell you that from the get-go. When you get your bill for a couple $1,000s, you're going to figure it out. The epidurals may be covered by your insurance, whatever it may be. In some cases, if some treatments like his VAX-D, which is covered by many insurance companies, workers' comp and auto, may not be covered by your insurance for any reason, or you may have some out-of-pocket expense more above and beyond what you would pay for, say, surgery or something like that. What's more important than quality of life? We have an over 92% success rate with this procedure. People are glad to pay for this procedure. We give nice discounts. We have in-house financing, out-house financing too as well if you need that. We make it feasible for everyone to receive this procedure. I have some questions I always ask patients. Do you want to avoid surgery? Most people want to avoid surgery at all costs. They know it's a permanent procedure with possible permanent complications. Do you want to avoid pain meds, pain shots, injections? Most people do because they know they're Band-Aids. And if we can make this economically feasible to afford this treatment, are you on board? And most people are, especially if we can make it feasible for them. And we do. We give extremely good discounts on the program. over what the normal fees would be. If you were paying for things individually, we bundle them together. We make it very economical, and we have payment plans for patients as well to make it affordable for any patient to get this treatment, and they need this treatment. And even if it's not covered by your insurance, in some cases it is, some cases not. Again, we make it affordable for you because we feel it's so important that people have a natural, safe alternative to cutting into your body and all the potential permanent complications, scar tissue, infection, bleeding that can occur with spinal surgery. So again, thank you for listening. This is Dr. Pete Peduzzi with the American Back Centers and the Disc Relief Centers of Pittsburgh. We'll be on next Wednesday with another podcast. Have a good week. Bye-bye.